Bipolar Hemiarthroplasty in elderly female neck fracture. I came from Seoul, Korea. Background is displaced neck fracture in elderly is one of the common clinical problems. The most common treatment in many situations is cemented hemiarthroplasty. The advantage is easier surgical techniques and lower the higher risk of dislocation and short operation time, but disadvantage is revision surgery, pain, acetabular erosion, and especially limping. The limp is the most frustrating symptoms after bipolar hip arthroplasty, and the main cause of post-operative limp is leg length inequality may be anticipated. So, in leg length and stability in regarding, the longer the operative leg, the tighter the soft tissue, the more stable hip we think. But acetabular wear, increased pain, increased limping. And bipolar hip arthroplasty did not grant the elimination of the pain by Laza in 24 in JBJS. And another, what Dr. White said, no statistical association between leg length discrepancy and the functional outcome after hip arthroplasty. The purpose is to evaluate the influence of the limb length discrepancy on function, second, dislocation, third, pain, and the last, acetabular wear, between lengthened and non-lengthened group. Such strategy is a retrospective study, and from August 24 to July 28, medical record, radiography, evaluation, and by telephone. Inclusion and exclusion criteria. Exclusion criteria was muscle disease, walking disturbance, severe history, Parkinsonism, and previous hip surgery. Some 30 cases in each group. Group 1 is limb length less than 5 millimeters, and group 2 is limb length more than 5 millimeters arbitrary. The outcome is in regarding functional evaluation, the second, pain by VAS score, dislocation, medical record, and radiography, acetabular radiography, and the function was Harris hip score and ADL. Surgical procedure, one senior surgeon, and the mean time to surgery is 4.3 days, and the post-lateral approach in all cases, and repair of short external rotator to the greater contour and the capsule. Post-op management was abduction filler for 1 week, weight bearing was standing at 7 days because of the old age. Component femoral stem extra hip system and acetabular side stainless steel or polyethylene and ceramic. Statistics was SPSS program and the chi-square test was a test. Limb length measured as like this. Measuring acetabular wears like this for the center of the femoral head and the line. Measuring acetabular wear, the space between acetabular side and the femoral head. Age and gender is as figure. Age and gender, the result, limb length discrepancy in each group, group 1 and group 2. The mean was, group 1 was 0.3 millimeters, and in group 2, 8 millimeters. The significant statistics result was regarding to function not significant. If in regarding to function, there is no significant statistics. In regarding to pain, in group 1, 3.53. In group 2, 2.23. Statistical significance is noted in regarding to pain. Acetabular wear, some shows. No. 2 years follow-up in acetabular wear technique. measuring technique. Summary. For functional evaluation, Harris-Hip square and ADL didn't show significant difference between two groups. The second, only one dislocation was in below 5 millimeters lengthened group. Third, pain VS score was related to the limb lengthening group. 4. Acetabular wear was somewhat related to the limb lengthening. Conclusion. Limb length discrepancy was associated with pain and had no effect on acetabular wear. Thank you for your attention.